Today, I'm going to teach you 3 breathing techniques that can lower your blood pressure in just a few minutes. These are simple techniques that almost no one talks about, yet I see them work every single day with my patients over 60. They're not complicated methods or anything far removed from your daily life. They're practical adjustments in how you breathe that can trigger immediate responses in your body. My name is Dr. Emily Carter. I've been a cardiologist for over 20 years, and I've worked with hundreds of adults over 60 who came to me believing they had completely lost control over their blood pressure. Many were already taking 2 or even 3 different medications and still dealing with sudden spikes that caused fear, anxiety, and constant uncertainty. What most of them had in common was a nervous system stuck in a permanent state of alert. Whenever you breathe in a short, rapid, or shallow way, your brain interprets that pattern as a sign of danger. Even if you're resting on the couch or watching television, your body reacts as if something is wrong. It releases cortisol and adrenaline, speeds up your heart rate, and tightens your blood vessels. All of this happens automatically and quietly, raising your blood pressure without you clearly realizing why. When your breathing becomes slow, deep, and intentional, the message sent to the brain changes completely. Your body understands that it's safe. Your heart rate slows down, your blood vessels begin to relax, and blood flow becomes more efficient. This simple but powerful physiological shift is often enough to cause a real drop in blood pressure within minutes. I've seen this process repeat itself countless times in my office. Patients arrive visibly tense, worried, with elevated readings, and after just a few minutes of guided breathing, their numbers come down noticeably. Not because anything magical happened, but because the body finally received the correct signal to leave survival mode and slow down. That's exactly why, in this video, I'm not just going to explain concepts or talk about studies. I'm going to practice with you. The goal is for you to feel these changes in your own body. When you realize you can influence your blood pressure consciously, something shifts. Fear decreases, confidence grows, and a sense of control begins to return. Before we start the first technique, subscribe to the channel so this information can reach others who also need a simple and safe way to control their blood pressure. Now let's begin. The first technique I want to teach you is one of the most effective ways to reduce blood pressure spikes related to stress. It's called 4-7-8 breathing, and it works directly on the part of your nervous system responsible for relaxation. This technique is especially helpful if your blood pressure rises during moments of tension, worry, or anxiety. I clearly remember a patient named Carlos who was 71 years old and experienced frequent pressure spikes whenever he felt emotionally overwhelmed. Even with his medication properly adjusted, a stressful situation was enough to send his numbers up. During one appointment, I taught him this technique and asked him to practice it with me right there in the chair. In less than 2 minutes, his facial expression changed, his shoulders relaxed, his breathing deepened, and when we checked his blood pressure again, the numbers had dropped significantly. It didn't fix everything overnight, but it proved something essential. His body was still responsive and capable of self-regulation. 4-7-8. Breathing works because it lengthens the exhale. When you release air slowly, your body receives a clear signal that there is no immediate threat. That signal activates the parasympathetic nervous system, reduces stress hormones, and allows blood vessels to relax. Now I want you to practice with me. Sit comfortably, with your spine upright, but not stiff. Place one hand on your abdomen so you can feel the movement of your breath. First, gently exhale through your mouth, fully emptying your lungs, without rushing, as if you're letting the weight of the day go. Then, inhale through your nose, mentally counting to 4 as your abdomen expands. Hold your breath for 7 seconds while staying relaxed, and then slowly exhale through your mouth for 8 seconds. Repeat this cycle a few times. With each repetition, notice how your body responds, how your mind slows down, and how tension begins to ease. The second technique I want to introduce plays a different role than the first. While 4-7-8 breathing is excellent for calming sudden spikes, this technique works as a foundation for daily stability. It's known as resonant breathing, and it helps the body stay balanced for longer periods, reducing the likelihood of sudden increases in blood pressure. Over the years, I've noticed that many patients don't only struggle with isolated spikes, but with blood pressure that constantly runs high, always on the edge. It's as if the body never fully relaxes, Resonant breathing works directly on this ongoing state of tension, teaching the nervous system to operate at a calmer, more organized rhythm. One of my patients, Helen, was 75 and told me her blood pressure fluctuated throughout the day, even without obvious stress. At home, it was sometimes acceptable, but the smallest concern could make it rise. We introduced this technique as a simple daily practice, just a few minutes in the morning and evening. After a few weeks, something interesting happened. It wasn't just her blood pressure that improved. Her sleep became deeper, her anxiety decreased, and she felt more confident checking her readings. Her body began responding more predictably, without sharp swings, which is critical for cardiovascular health. Resonant breathing works by creating a natural synchronization between your breathing and your heart rate. When you breathe slowly, inhaling and exhaling for the same length of time, your heart settles into a more efficient rhythm. This improves circulation, reduces strain on the heart, and helps keep blood pressure under control. To practice, simply inhale through your nose for a count of 5, then exhale through your nose for a count of 5. There's no holding and no effort. It's a smooth, continuous motion. That simplicity is exactly what makes this technique easy to maintain in everyday life, even if you've never done breathing exercises before. The biggest advantage of resonant breathing is how easily it fits into your routine. You don't need to lie down, isolate yourself, or create a complicated ritual. You can do it while sitting, waiting for an appointment, watching television, or even before going to sleep. Your body quickly learns to recognize this rhythm as a signal of safety. I remember a patient who struggled with what we call white coat syndrome. Every time she walked into a medical office, her blood pressure spiked. At home, her readings were reasonable, but at the doctor's office, they were always high. I taught her to practice this breathing for a few minutes in the waiting room. At her next visit, her numbers were noticeably lower, not because fear disappeared completely, but because her body was no longer overreacting. Her breathing sent a clear signal to the nervous system that there was no immediate danger, reducing the stress response. This technique is also extremely helpful at night, especially for people whose minds race when they lie down. Many report that practicing resonant breathing before bed leads to deeper, more restorative sleep. Better sleep alone can significantly support healthier blood pressure the following day. With regular practice, the nervous system begins operating at a lower level of activation. That means less adrenaline circulating, less muscle tension, and less strain on the heart. Over time, the body learns it doesn't need to stay in constant alert mode. It's important to understand that this technique isn't only about immediate results, but about consistency. 5 to 10 minutes in the morning and evening may not seem like much, but over weeks, this habit builds a strong foundation of balance. Average blood pressure tends to decrease and spikes become less frequent. As patients notice this gradual change, something important happens. They stop living in fear of the next reading. Breathing stops being just an exercise and becomes a quiet tool of control, woven naturally into daily life, without effort and without relying on anything outside themselves. The third technique I want to teach you is what I often call a rescue technique. It's especially useful when blood pressure rises suddenly, accompanied by anxiety, chest tightness, or the feeling that something isn't right. Many patients describe these moments as frightening, because they feel they've completely lost control of their body. I worked with a patient named Robert, 68 years old, who would wake up in the middle of the night with extremely high blood pressure. Fear made his heart race even more, creating a dangerous cycle. He had gone to the emergency room multiple times because of these episodes. When he learned alternate nostril breathing, his relationship with these crises changed dramatically. This technique works because it forces the body to slow down immediately. By alternating the breath between nostrils, you activate nervous system mechanisms that reduce the stress response. The brain receives a strong signal of reorganization as if it's being pulled out of extreme alert mode. To practice, sit comfortably with your spine upright and use your right hand to guide the breath. Close one nostril, inhale slowly through the other, then switch. The rhythm is calm, steady, and deep. There's no rushing, because the structure of the technique itself prevents fast breathing. When I guide patients through this exercise, I always ask them to notice what happens in their body. The mind slows down, the heart loses that racing sensation, and the feeling of urgency fades. Many people feel a clear shift even before checking their blood pressure again. This technique does not replace medical care or medication when those are necessary, but it can be crucial in preventing a pressure spike from turning into panic, which only worsens the situation. Within minutes, it helps the body leave the danger zone and regain balance. Now that you know all three techniques, the most important thing is understanding how they work together. This isn't about choosing just one and ignoring the others. Each technique has its role, and using them at the right time is what leads to real, lasting results, especially after 60. 4, 7, 8. Breathing works as daily training for your nervous system. It teaches your body to respond better to stress before it becomes a problem. Resonant breathing serves as maintenance, helping keep blood pressure more stable throughout the day and over time. Alternate nostril breathing is your emergency tool. It's what you use when you feel pressure rising quickly or anxiety taking over. Simply knowing you have this tool available can completely change how you experience those moments. One patient, Susan, 73 years old, committed to practicing all three techniques consistently. Even while taking 2 medications, her blood pressure remained high, and her doctor was considering adding a third. After 3 months of daily practice, her numbers dropped by more than 20 points, and the plan to increase medication was put on hold. What I always tell my patients is that consistency beats intensity. Practicing once and expecting permanent change doesn't work. Just as medications are taken daily, conscious breathing needs to be part of your routine. Over time, the body learns and adapts. Your breath is a powerful, free, and always available tool. It gives back a sense of control many people feel they've lost over the years. If this video helped you, share it with someone who also struggles with high blood pressure. Subscribe to the channel because my commitment is to keep teaching practical, science-based strategies to care for your health with more confidence and less fear.